Hi, everybody. This is Dr. Tahir from Family Pediatrics, and thank you so much for joining us today. We have Gabby here, and we have Benny here, and we have cute little Cinco here. That's his nickname. Cinco is, how old is he now? He is about a month old now. So one of the concerns that the parents have is that he's having some discharge from his eyes, and it's a very common kind of an issue. So I wanted to talk to you about that and talk to you about how we do some therapy for that, and you as a parent will do that at home. So I'll be showing you a close-up of the eye area and talk to you about what the issue is and how we address it. Okay? Excellent. So let's have cute little Cinco lay down right over here on the table. All right, sweetheart. Here you go. So right now it looks like it's this eye that's affected, correct? Mm-hmm. Okay. Well, what I'll do is I'll be showing this eye, same difference, but it'll be easier for the camera. So sometimes what you'll notice is in the mornings or other times of the day, you'll have yellow material that covers the eye in the morning, especially covering the corner of the eye. And the reason that happens is that all of us have a small little tube, a little duct called a tear duct that connects the eye to the back of the nose. So it goes from here to the nose. And that's why we sniffle when we cry, because the tears run down that little tube into the nose and make us sniffle. Now, in babies, because that tube is so tiny, it can get clogged easily. And when it does, then you may see tearing of that eye and also some of the yellow material. Normally, all of those things drain into the nose. So what I'd like you to do is take your little finger, and you'll be simply putting that on the corner of the eye and the nose and rub in a circular motion like this about 10 times. You see, it doesn't hurt them. We're not pressing very hard, but you're pressing enough to, if you practice on your hand, for example, you can pressing, so you press on your muscle a bit, okay? So it's a little bit of pressure, but not very hard. If he's uncomfortable, that means it's too hard, okay? And you want to do this before you change his diapers, simply because it helps you remember, and you do it many, many times a day like that. Mm-hmm. Now, babies can have that blockage of the tube come and go. So sometimes it'll be better, sometimes it'll be worse. Over time, though, as he gets older, it goes away. If it doesn't, by the time he's about 6 months to a year old, I'll often have you see an eye doctor for him who can look at that, and sometimes, depending on what the eye doctors feel, they will take a little plastic plunger and they actually plunger that tube open so that it stays open, okay? But we don't do that right away. We wait a while to see if it's going to get better all by itself, okay? Any questions about that? All right. So this is cute little Benny, and he is going to get that tube fixed up, and he'll be all happy to go. Thank you so much for joining me today, you guys. You have a wonderful day, and thank you so much, Benny and Gabby, for being in the video today.
Thank you.
All right, you can go ahead and hold him.